Test 1, 2. Okay, we good? Okay, good afternoon, everybody. Thank you for the media for being here today. This is what we normally do on Tuesday at City Hall, and because of a City Council meeting that ran, we wanted to reschedule this to today, and we're glad the media is up here. We want the community to see that we're doing great at keeping our community safe. You can see behind me, we have a great second dose vaccine drive going on right now. It's been happening since early this morning. And my own observation and the comments from the staff working is that every time we do a vaccine drive, it gets better and better. And I think our clients tell us the same thing. So I'm going to cover some material this morning, and then we'll have Nueces County Judge Barbara Canales speak, as well our health director will speak as well. Now, Mayor Guajardo, who normally would be here, and I do have a statement I want to read from her to the community. Due to a schedule conflict, she was unable to make it, but she does have some prepared remarks that I'm going to read to the community here. So the mayor wanted to let the community know that last Saturday we held a different format of a drive-through at the American Bank Center, where we used the outdoor parking lot instead of riding the vehicles inside of the arena. And we had some record time distribution of the vaccination administration, which is great. The clients had to wait very little. In about 30 minutes from beginning to end, people were vaccinated. That's a tremendous improvement. We were able to vaccinate 2,500 first dose patients or clients there last Saturday. We averaged about 600 vaccinations an hour at the American Bank Center. We know that up here at the Orchard Fairground, we have vast facilities and big parking lots, but the San Antonio mayor and city council and staff know and hear that the community wants something a little closer to downtown Corpus Christi, and that's why we're using that American Bank Center venue in partnership with the American Bank Center staff, and we appreciate them. We want to thank, on behalf of Mayor Guajardo, all those that volunteer at American Bank Center. That includes our health director, the Corpus Christi Police Department, the Corpus Christi EMS, Fire EMS group as well, and all the doctors and nurses last Saturday that made that drive-through possible. We owe you a big gratitude of thanks. Now, we know that the mayor has been a steadfast proponent. Actually, it was her idea. She's the brainchild of it, of the Save Our Seniors program. And this is important to that senior community out there that are homebound and just can't make a drive to either the American Bank Center or the Richard Borchard Fairgrounds. That model that was developed and implemented has now, if you haven't seen, become a national model. Governor Abbott was here just recently. The city of Corpus Christi has made national news. I don't know if you all have seen, but CNN covered that story of how the governor was so impressed with the city's Save Our Senior program that the governor is launching it statewide. He's using 1,100 National Guardsmen to go across the state of Texas in 26 counties and do the same thing we're doing here locally, that our fire EMS personnel were first to do. Now we're going to have it done statewide, the governor is, because he was so impressed by the model that we had here. That gives us this very important vaccine to those homebound seniors, again, that are just too frail, may not have transportation or the wherewithal to get out. And so the city of Corpus Christi and now the state of Texas, based on our leadership, is taking those vaccines directly to seniors. Next week, this is an important note, next week, Wednesday, we're going to open up the call center to take new clients for the SOS program. Right now we've been working through second dose vaccines from a couple of weeks ago where we gave the first dose, and we were also working through a predefined list that we had. Those were seniors that were on our food program. But next week we'll begin to open up registration for all new clients to receive first dose for the SOS program. Okay, so more information will be coming out, but we just did want the community to know that this morning. Okay, now behind me here is an event going on. You may have seen some headlines. The city and the county and other partner agencies between today and tomorrow are holding 7 clinics that'll vaccinate 12,000 people. I do believe that's a record, right? In any one time in our community, 7 different clinics going on, some simultaneously, vaccinating 12,000. In Nueces County has got it together. It shows that we have great teams working together, and it shows that we care about the community. Otherwise, we wouldn't be doing this. We wouldn't be having this great feat. So today, what's going on behind me is a second dose vaccine drive. Later this afternoon here at the same facility, we'll be doing a first dose drive put on by the Health District. Also today at the American Bank Center, our partner Driscoll has simultaneously a first dose drive underway right now. A fourth one is tomorrow, March 6th at West Oso High School. The City Health District will be doing a first dose drive there with a focus on teachers and educators. That'll be at West Oso High School. That's the first time we'll be at that facility. It is open to all eligible 1A and 1B persons, but we do have a focus on educators. We know recently the governor's expert task force expanded that group to include teachers, daycare providers, college persons as well. Also tomorrow, we'll be doing a small drive at St. John's Baptist Church on the west side. That's going to be taking place tomorrow. The City County Health District will be managing that. Another big one will be taking place at Roy Miller High School in the near downtown Roy Miller High School. This is put on by Cecil and other partners. That'll be tomorrow, similar to the one at the West Oso. The focus will be on educators, although all 1A and 1B are eligible for that vaccine drive. And then finally, the 7th event tomorrow will be at the American Bank Center. This is where HEB will have 1,000, for the first time, Johnson & Johnson vaccines tomorrow at the American Bank Center. 1,000 persons are expected to be receiving for the first time in our community the one and done Johnson & Johnson vaccine, right? So that's 7 different events happening today and tomorrow, 12,000 vaccines to be administered. We want to thank not only our staff, the county staff, but those partner agencies that make it possible as well, Driscoll, CCISD, HEB, to name those most significant ones. Just a couple more things from my perspective, and then I'm going to turn it over to the judge. So we know that, and I know many persons have tried to reach the city for comment. We know that the governor's orders are released, if you will, Wednesday at midnight, so Tuesday into Wednesday at midnight. And that would make wearing masks voluntary, right? That's one of the key things that we're focused on. I want the community to know, and we'll be communicating with our city employees, that all city employees are still going to be required to wear a mask. Our city employees have not had the opportunity to be vaccinated, for the most part, 1C group, and so we're waiting for the expert panel to allow them to have the vaccine. So until then, we want to make our work environment safe for everybody, in case people haven't been vaccinated. And so we'll continue to make wearing a mask for city employees a requirement. It'll be a mandate. I'll be working with the mayor. We have been working, but later today or early next week, we'll make an announcement on patrons coming into city facilities, whether or not a face mask will be required. Okay, so we'll let you know more on that. And then finally, we know that spring break starts, it kind of unofficially started yesterday, and today we expect more tourists coming into our community, and certainly for the next 2 weeks. But we do want to remind our community to be safe. I mean, when we have people coming in from San Antonio, Houston, all across Texas into our community, that just increases our risk chance, right, for catching COVID. We know that even with the vaccine, there's still a 10% chance to be exposed to it and to catch it. And I did want to remind the community that we still have new COVID cases every day. In fact, this week, our case count for new COVID cases is up by about 7% compared to last week. So week over week, we have more persons that are impacted for the first time by COVID. So yesterday, as an example, 72 additional persons were diagnosed to have COVID. And we don't like that, right? The number we want to be way down there into the single digits if you can. The day before it was 61, there was 60s and 70s for the past couple of days, which is not good. Yesterday, the number of persons in the hospital because of COVID increased. There's 75 people. That's an increase from the day before. And then the number of persons in ICU also went up yesterday. There's 31 people in ICU. And the unfortunate thing is, and it's been maybe not talked about so much recently, but deaths still do occur, and that's the biggest reason we're trying to fight the virus from COVID. So yesterday, 2 people died because of COVID, and through the week, the numbers have been as high as 4 a day, back to back. We've had some 2s and 3 deaths each day over the past 7 days. So we want to remind the community that COVID is still here, it's still real, it's still very dangerous, it's still very deadly, and we want to keep the community safe. So everybody has to do their part by following those protocols. Annette will probably talk about them again today as well, of keeping ourselves distanced by 6 feet. Wear that face mask. Even though the governor's order goes away, there's no reason to not wear that face mask. We're going to be still wearing ours for several months more. I'm going to be requiring all city employees to wear those, no matter if they're inside, outside, in the vehicle, on the beach. We want to keep our employees safe, and we want to keep the community safe. So continue your protocols. Know that COVID hasn't gone away. Know that there's a lot of work to be done before we're in a safe zone. So with that, is the judge coming up next, or Annette? Who's up next? Okay, we'll have Annette come up next. Okay. Oh, here's the judge. Annette, do you have anybody have a tissue? Or what, do you have a wipe? Just a second, Judge. Look at this. There you go, Judge. It's kind of wet.
Barbara Canales, Nueces County Judge. I want to reflect upon the week's events. There is no doubt that you've just received all of the important information, and of course we can go over any of your questions regarding some of the clinics that you've been hearing about. It's going to be a tremendous effort this weekend, but it's really been just a tremendous effort all week. I think what most people want to discuss is the governor's executive order. So because we could not gather on Tuesday, I'd like to almost step back in time and take a moment to talk about that order and what it means. So as I said, Governor Abbott earlier this week issued that executive order, which did rescind most of his earlier orders relating to COVID-19. And as we all know and have heard, next Wednesday is the day that those orders become effective. Any type may open up to 100% capacity. Additionally, this order ends the statewide mask mandate in Texas. Now, in my capacity as county judge, I need to square up the orders that we had in place that were mimicking the governor's orders with these new orders. And as it turns out, it's a good thing that we have Commissioner's Court on Wednesday, so we'll be able to do all of that announcement in Commissioner's Court. We invite you, the media, to attend with us so that we can showcase for you the signing of those rescissions of orders and also discuss next steps. Now, I made mention of this, and I think it's really important that we are approaching 1 entire year since the statewide disaster declaration was made by the governor, which was March 13th, 2020. And we've also reflected on what a very long, exhausting, and tragic year it's been, with over 700 deaths in our own community. The virus, of course, we all know is just has taken a tremendous toll on our loved ones, our neighbors, our co-workers, and in fact, our entire economy. And it's taken, as I said, so many lives nationwide, over 500,000 across our nation. And this virus required us to do so many things to make certain that we protected ourselves. And we're still doing all of those things. So please know that the city, county, public health, and through other efforts by the state of Texas, we're still engaged in robust testing. And as the city manager reflected, we don't like to see any number but the lowest single-digit numbers. So in the 3-digit column. So let's stay vigilant and stay with knowledge that we are still testing so that we can isolate. We still have monoclonal antibodies. all the way to our COVID clinic. And for all information about that, please focus on noisisknows.com. So look, our normal lives have not been normal since that fateful day for me back in February when we really started to engage in our COVID-19 response. But certainly here in Nueces County, March 17th when we had our index patient. And again, COVID poses a real threat to public health. And all the mitigation strategies that we know also have costs of their own. And so these restrictions that were imposed to help prevent the spread of the virus. And even though they've been modified over time, when they really appear to be working, we know that we need those positive trends to continue. So all the good things that we've done as a nation to develop better testing, better resources for testing. Early detection means early treatment. The developed therapies, the medications to lessen severity, and of course, ultimately, what's going on right behind me. This is the ultimate, the vaccine. And we want to encourage all to get the vaccine. We don't want to see vaccine reluctance because we know that there is great protection with this vaccine. There is great efficacy with this vaccine, and not just the one we deliver here today, Moderna, but Pfizer, and now Johnson & Johnson. And so by next Wednesday, in shots delivered in the state of Texas. And over half of those are going to seniors, at least one shot. And by the end of this month, March, the governor has declared, our state has declared that every senior who wants a vaccine should be able to get one. And so I was in Austin, I just drove in. I've been in Austin the last 2 days, and I have been talking to members of the vaccine allocation panel. I talked to Chief Kidd. I talked to so many people who have all echoed that we should see Texas getting more vaccines. And so Texans, I want you, and specifically Nueces County residents, to have hope that as amazing as 12,000 is this week, more is on its way. And the Texas Department of State and Health Services also issued a very important directive. And I want to talk about this because it's going to be in action, as you heard, at Roy Miller High School. And it was an action earlier this week at Memorial. And that is teachers, daycare workers, and other educators in all facets of our schools will be eligible to get vaccinated right now. No longer do we have to be just in that 1B category. And so regardless of your age, regardless of the health condition, if you are a part of the education system here in Nueces County, this is an all call to you. We want you to get vaccinated. We want to protect you, and we're going to do everything in our power to provide the means to do so, starting with our partner Driscoll at Roy Miller. Earlier this week, we did it with our partner Krista Spahn. This is not our first time. This is our third time to vaccinate educators. And while we were in that 1B category, it still shows a tremendous commitment upon Nueces County as a whole, including the city of Corpus Christi, to take heed that our educators are our most valued essential workers. And so as we see more vaccine coming, be prepared to see more of these mobile clinics. And I'm, again, very proud to say that we've been on the front lines from the beginning, building capacity. This is what this does, whether you're at the American Bank Center outside or the Richard Borchard Fairgrounds. This is exactly our mission. I said it this morning to our coordinator. We are here to send the vaccine into as many arms as possible. And that's why this location and the American Bank Center is so good. Now let's go back to the governor's order. We knew that mandates one day would be lifted. We knew that, right? And in fact, we also knew that we were going to have to make a choice about the kind of place we want to live in and work in and the kind of behavior that we want to engage in sooner or later without somebody making it an order. And let me be clear, there is nothing the county judge can do to override this order. That needs to be made clear. However, the governor gave tools to all of us, and I want to emphasize those tools. For starters, if we see that our hospitals get to a place where there's 15% capacity, they're occupying COVID beds, 15% of the hospital's capacity, the county judge is empowered to impose restrictions to help us go the other way. And so that was a very welcome tool that the governor put in that order, and we thank him for that. In addition, it does not negate or deny common sense, common courtesy, or smart science, or all of the practices that we know work. So I want to say that these provisions in the governor's new order allow for businesses of any kind to still limit capacity or implement additional safety protocols at their own discretion. Let me say that again, because that is the most important tool the governor gave us. He said that any business may still limit capacity or implement additional safety protocols at their own discretion. And I fully expect, as I have been receiving lots of correspondence, that businesses will make those decisions. And I ask that you help us by respecting those decisions as neighbors. I think that the other thing is really important is that the governor encouraged, he actually said that in the order, that he strongly encouraged to use good faith efforts and available resources to follow the protocols that have been set forth by the Texas Department of State and Health Services. And I would ask you to follow those recommendations because we know they work, we know they save lives, and I'm going to do it. And I think that our county commissioners court come Wednesday will also be able to have a robust dialogue about how we will care for our county employees and all of you that use the county courthouse for public services. Now, one thing I want to say is there has been some discussion about an executive order. There's still legislative orders and judicial orders. And so we are still looking for clarity, but the Supreme Court, through the Office of Court Administration, will be able to dictate what orders they deem appropriate for safety in the courtrooms. And as they develop those rules, we will bring them to you. And the same is true for the legislative branch. As I told you, I was in the Capitol, and although it's not mandated, there is a big, great tent, and everybody goes to get tested before you go in there. So there will be individualized plans that will be used between the judicial branch of government, the legislative branch of government, and the executive branch. And here's the big one: private citizens and private businesses. We are all called upon to take personal responsibility, and we need it more than ever. I'm calling upon all Nueces County citizens and residents to be, as I said, good neighbors, take care of one another. That's how we started in this pandemic, and this is how we must finish strong. Do your part. Stop now. We're so close. Look at the hope that's coming through this barn, this exhibit hall. Every one of these cars is here because they know this vaccine is life-saving, and they are here to receive it by the thousands. We never, ever have more than we need. We always have less. That's why we're always asking for more. So in the next few days, as I said, we'll be working with our business community, with our other political jurisdictions, to make sure that everybody understands what these orders mean. I would like to tell you that from the federal side, the RTA will continue their mask order. And as I receive more information from other entities, I will also display it on our website and also bring it to you here in the media. Let me close with this. This pandemic is not over. Not over by a long shot, unfortunately. And COVID did not disappear. And so we all need to live up to the promise of what is good about Texans, and that's working together. Be Nueces strong. Don't just say it, be it, and live it, and preach it, and do what it takes to still stay safe. And that is our new hashtag today, still stay safe. If you all have any questions about any of the clinics that we've run, Monday we ran a Port Aransas clinic. Tuesday we ran a clinic at the Memorial hospital on Morgan site for educators. I expect more vaccine. I expect more clinics. I expect to partner up with a variety of providers outside city, county health, nurses, physician's assistants, and doctors. If you're interested in being part of the Nueces County team as we take our clinics to neighborhoods and to the rural community, please call 888-0444. We need you as vaccinators. We need you as people who can help register people. We are not going to stop until we reach herd immunity, which will take us all through the summer. And so I'm looking for extra help. And I like to think that there are great people out there that will answer this call to arms. Thank you, and we look forward to your questions and again to continue to serving you. Please don't forget to pay it forward. Say thank you to these people donned in PPE. Please make sure that you understand why this week. And I'm grateful to be able to share this opportunity here in the fairgrounds to showcase what a jewel it is, what an asset it is to Nueces County and to our region. Thank you. There's no Spanish translation, so for Univision o Telemundo, más tarde hablamos enseguida sobre todo lo que acabamos de decir. Gracias.
Annette Rodriguez, Public Health Director. So I wanted to start out by letting everybody know that we did receive next week's allocation. That's really important because I know every week people are expecting that first dose allocation. And so we received it yesterday, and that was 5,000 vaccines. So I talked a lot about 25,000 vaccines coming in next week. That didn't happen, but we're anticipating the following week that possibly happening, and we're hoping that it does. The more vaccines we have, the more people we can vaccinate in this community. So today, just so everybody's mentioned, I think the city manager as well as the county judge, that second doses are this morning, and they're the people that were vaccinated on January the 29th as well as February the 2nd. If those individuals did not receive a reverse alert, but you know you were vaccinated here at Richard Borchard on January 29th, or you were vaccinated at the American Bank Center on February the 2nd, come in today before 3 o'clock today so we can get you vaccinated. We're doing our best. We've done over 60,000 vaccines that we vaccinated at the health district, along with all of our county, city partners. You know, it takes a whole team to be able to do this, like the county judge just mentioned. So our IT people are here, and so we're grateful for everybody that's here helping us. We also have our Del Mar students here today that are helping us vaccinate. We have 50 of them, so thank you, and a great shout out to Del Mar students for helping us. Tomorrow, well, let me go back to today. So this afternoon, we're also going to do first doses. So again, the first doses for next week came in early. They came in yesterday. So we're going to do first doses this afternoon here, 3,000 people. So today will be our largest vaccination hub site with a total of about 7,000 people at least. We invited that many. We hope that they all come and get vaccinated. Tomorrow we will continue with our first doses, and those, as were mentioned earlier as well, those are for the teachers, these are for administrators, for people that work at the schools, as well as people that work at the daycares. The governor's new orders allows them to get vaccinated, and so tomorrow high school, it starts at 10, the event, and we will get all of those individuals taken care of. Hopefully at least 2,000. If we can get more because we get additional doses, we'll take care of them as well. We're also doing St. John's Baptist Church tomorrow at 10 a.m. And so we'll get probably 200, 300, 400 people vaccinated at that event starting at 10 as well. And then the next vaccination clinic is going to be Saturday, the 13th, and that's for second doses for people that were vaccinated on February the 9th. So if you're listening to this and you know you were vaccinated by the health district on February the 9th, your second dose clinic is coming up, and that's going to be on March the 13th, Saturday, starting at 9 a.m. And we will reverse alert you, but again, don't wait on a reverse alert. We're reversing alert a lot of people. And so if you don't get the reverse alert, you can still show up and we'll take care of you. I think it was mentioned by both city manager and again the county judge that the governor did rescind the orders of mandatory mask wearing next week. But he didn't say that you can't wear a mask. He never said that. In fact, he said he's leaving it up to the businesses. And so, because it not only protects you, but it protects other people as well. And so be thoughtful of others. You know, maybe you've been vaccinated, but not everybody else has been vaccinated. So wear your mask. It's still not the right time to let your guard down, to take your mask off, because we all know that we have variants. You know, we have different variants in the community. We know for certain that we have the B117, the UK strain in Nueces County. And so with spring break coming, we think that we're going to see more variants. We're hoping not the B1351, which is the South Africa strain, because we know it's more deadly, but we could see those strains coming. So your mask is going to be your best protection. Again, you know, spring break is upon us. Protect yourself, and that will protect other people. So I'm going to end by saying wear your mask when you're in congregate settings. So if you're at home, you don't have to wear a mask. But if you're in congregate settings with large groups of people, please wear your mask. Also, wash your hands often. Washing your hands is going to keep those hands clean. So if you do accidentally touch something, you don't accidentally rub your eyes or your nose or your mouth and contaminate yourself and then get COVID-19. And social distance from strangers. We still don't know who's been vaccinated and who hasn't. We know that we've done over 100,000 people that we've vaccinated in Nueces County, but that's not enough yet. We need to vaccinate the majority of the people, 70 to 80% of the people, before we're going to start seeing some herd immunity. So I want to take a minute just to say thank you to Chick-fil-A. They're actually going to provide supper for all of these people that are working today, the Chick-fil-A in Calallen, so thank you to them. Very much appreciated. And for everybody else, stay well, and as always, stay informed. Thank you. Are you asking questions? Are you going to open it up for questions?
Okay, we can take questions either from myself or the judge. Go ahead. Let's see, the HEB event tomorrow. Do we know what time it starts, see? HEB event? Do we know what time the HEB? 9 a.m.? Okay, the HEB event that'll be at Driscoll for the Johnson & Johnson vaccine, that begins at 9 a.m. Now, I don't know if we mentioned, but all the vaccine drives, the 7 that have taken place over the next 2 days, all those are appointment only. So everybody's been pre-registered, including the HEB Johnson & Johnson vaccination drive. Will the city be getting, will the health district get, yes. So Annette Rodriguez, our health director, has put a request in for 25,000 initially, Johnson & Johnson vaccines. We like that vaccine because when we do off-site vaccine drives, say at the island or on the west side or on the east side, it's easy in that the patron doesn't have to come back a second time. And so if we go to a remote location that doesn't have this nice facility like we have here or at the American Bank Center, we only have to go there once. It makes it a lot easier. We put in a request for 25,000 of those, and we do expect to get some soon. Yes, sir? Annette, have you heard anything about the auxiliary nurses that are being bussed in every day? Are they leaving anytime soon? Okay, we haven't heard anything, but you know, our numbers, while they're less than maybe a month ago or some time ago, they're still in the double digits. And in fact, they're close to 100 per day. So we hope that they continue to drop. We're going to keep an eye on spring break, see if that has an impact locally. We're real cautious about that.
Why haven't there been as many vaccination events here at the Richard Orchard Fairgrounds as there used to be? a lot more across the
Yeah, so the community at large has said, look, we like coming to this event, and we want something closer to the center of Corpus Christi. And so the city and the county put our heads together and said, let's alternate sites. So one week we're up here, the next week we're at the American Bank Center. On top of that, we're using some of the vaccines and going even more specific to where people are, like teachers. We're going to several schools tomorrow, as an example. And so we're taking vaccines and we're using them geographically. Yeah, well, so it all depends on when the vaccine comes in. Like the first dose vaccine drive that's going to take place later today, that's because we got the vaccines yesterday. We don't want to sit on the vaccines and wait, right? And so the reason we're doing some tonight and even more, the clinics aren't set up when it's the best time of the week necessarily. So as soon as we get the vaccines, we administer them. And by doing that, we're guaranteed to get more and more. Our health director's been in this business for 30 years, and she's seen this over and over again with prior pandemics. Those that perform are guaranteed more and more vaccines, and we're proving that out right here today, in part by the leadership of Annette and that strategy. We don't sit on any vaccines as soon as we get it. Okay, do we have any other questions? Okay, great. Well, thanks for coming up here today. We're glad you were able to cover this for the community, and we appreciate the media and your continual coverage of the pandemic. Thank you.